Today's episode is going to be about acupressure because that's one of the techniques that I use in my office because I find it to be very helpful and very effective. I've been using that for years. It's difficult to explain fully exactly what acupressure is because I think it's a little different for everyone. True acupressure, which is called Tuina in Chinese medicine, is very painful to relieve muscle problems and things like that. Very painful because you get a lot of stagnation in that area. You get adhesions, you get scar tissue. Depending on how soon you get to the practitioner, you could be inflamed still. So it's going to hurt. But what it does is what the whole premise of acupressure is, just like acupuncture, it relieves energy blockages. And that's huge. Whether it's in the tendons, ligaments, part of the bone, it helps. And I find for myself, what I use it mostly for is, believe it or not, is more internal problems, stomach stuff, headaches, allergies, different things like that, because I base it on the meridian or the organ that I think is out of balance at the time. So I'll give acupressure to that area. And I always try to incorporate somewhere on the spine because I think it's extremely beneficial, like what organ, what vertebrae is related to that organ that might be causing this person's problem. And sometimes it's painful, sometimes it's not. Most of the time there's always a little pain to it, just because there's always stagnation. I don't know anybody who doesn't have stagnation, but also you should have a little discomfort. If I'm pressing at a point and it doesn't hurt, something's wrong if I'm pressing pretty hard, So that's what I use it mostly for, is to balance the body like I do everything else. And it's been around for so long. Touch is just so powerful, and different cultures and different societies used it in different ways to help, when someone was hurt or injured or not feeling well, because they all needed to work together, to be functional, to be productive. And when you're not feeling good, you're not as productive. And it makes a huge difference. And I find when I ask a person to practice something on their own, when I incorporate more of the breathing techniques, mostly from Oxygen Advantage and the Buteyko method, which I like, Patrick McEwen's techniques, I think are just phenomenal. I've been getting great results with them for years. It just takes it to a whole nother level, because the breath is so powerful. And incorporate that with acupressure, you got a nice combination there. Because acupressure, it could help with so many things, So I feel that's what makes every technique beneficial. And I'm not tooting my own horn. It's a practitioner. The practitioner knows how to utilize it. They could work with it in any way that you need to benefit. It's just like you ever see somebody who could really cook? Doesn't matter what's in the kitchen. They maximize whatever it is. Yeah, but other people go, it's not my spoon. It's not my pot. It can't be the same. And I say, well, then you really can't cook too good. You understand? It might not taste exactly the same, but if you know what you're doing, you tweak everything that you have. You have to be, as a practitioner, we have to be able to utilize, what we have. What can we do for that person that they need? And that takes a little skill, a little practice, a little bit of time. So sometimes it's not just in and out, and especially with something like acupressure. It takes a little time to work on the person, do certain points, because you just can't do it real quick. You got to do it. So you feel, at a certain point, you get to feel that something's moving. Whether it's the muscles are getting looser or the energy flow, it all depends, And sometimes you can't feel anything. You ask the patient, and they say they're feeling better. And to me, that's more important than whatever I'm feeling. Acupuncture is with needles. That's a total different practice. There's actually different schools that do acupuncture, that are trained for acupuncture, and there's schools that train just for acupressure. Acupressure is no needles. It's just with your hands. Yes, the points are the same 99% of the time if you go by that chart. If not, you could use whatever you use, but acupressure is definitely with the hands. I think a good example of what I utilize acupressure for is sprained ankles. I get great results with sprained ankles. And, you do a couple points and you do some points as you're moving the ankle. It's very painful, though. Sometimes I joke and I call it acutorture. I borrowed that from somebody, acutorture, because it hurts, and sometimes if a person can't take the pain, it's not going to benefit, because it's not a bad pain. It's like a therapeutic bruising, some people will call that. It stimulates the body to call its own healing mediators to that area and help to heal the body. Getting back to when I was talking about pain and torture, right? I know that's frightening to most people. But it's painful, I'm not going to lie, but pain tolerance is difficult to say. What hurts some people doesn't hurt other people, but everything's based on your tolerance. I'm not going to do something that hurts, and you can't take it. So painful and torture is not the right word. It's more maybe uncomfortable. some slightly uncomfortable to a little uncomfortable, depending on what you need. And then I gauge it. As we progress with the treatment area that I'm working on, I ask you, does this hurt too much? Is this enough? So it's a comfortable treatment, and it's very effective. Another example, acupressure, something more systemic, or internal, whatever word you want to use for that, is like if a person has stomach problems or digestive problems. I'll do a few points related to the stomach and the liver, one on the hand, one on the foot usually, and then of course something on the back, and it helps tremendously. And the 2 points on the hand and the foot, they continue to do when they go home, because it really gets energy moving and it helps balance the body. The reason I like to talk about the home care part of acupressure is because it works. It's very, very simple. I tell people sometimes if they're bloated, try pressing the point between their first finger and their thumb. It helps. You do it for a minute or two, your bloating will definitely go down. It'll definitely help with that. And then you could do things like when you're watching TV or if you're sitting, at a red light maybe or something. Those little things, I think, because the more you incorporate getting energy to move, the better off you'll be. It's just blood flow and oxygen, right? Keep it simple, not just energy. Everything's moving. And the more things move, the less stagnation you have. The less stagnation you have, the better off you are. It's like a river. When I talk about things move and flow, like I said, the river and the mosquitoes, there's so many sayings that have been said for 1,000 years, Things that are stagnant, just are stagnant. They don't move. I don't think anybody wants to stay still too long. But you got to move. Everything has to move. Your heart beats all the time, right? You breathe all the time. There's that little pause in between, right? There's that between the breath and the heartbeat. But more importantly, movement is key to everything. Balance, you got to throw balance into there whenever you're talking about any of this, because moving too much or not enough is what causes the problems. It's never the movement. Movement is key to life. Everything moves to keep you healthy and happy. Well, to be clear on what I was talking about with acupressure, it's included in 99% of my treatments because I find it that effective and that supportive of what I do. So most people, if not all, get some type of acupressure treatment. It's not just its sole by itself treatment. I combine it with everything I do, like all the other things that I do. So if you're wondering if you're a candidate for a patient for acupressure, I would say yes, 99%. I can't say yes to everyone. But when you come in, I'll address you. I'll look, do an exam, a thorough exam, and I'll let you know if you're going to benefit from it. Most people do. So, if you have musculoskeletal problems, that's that's simple for people to think you might be a candidate for acupressure. But more of the digestive issues, more of the sleep issues, some different things definitely could benefit you. And it's not a totally uncomfortable treatment. It's effective. So I think sometimes for a little discomfort to have some positive outcome, it's worth it. I think to wrap things up for everyone, to make it crystal clear, is I never do just one thing when a person comes in. I don't do just acupressure or breathing or qigong or the adjustment. I incorporate them all because I feel everybody needs different treatment. And that's what I do. I make it tailored to you, and it incorporates different things. So keep that in mind. Hey guys, do me a favor, follow us and like us on social media and visit our website, NewJerseyTotalHealth.com.